Hello everybody, Dr. Olivia Joseph here, and we are going to do our weekly FAQ, and this week we do not have a lot of questions, which allows me to elaborate more on the ones I do get. And some things are a little bit repeat, so if you're looking for more information on a certain topic, one thing you can do is you can go to our YouTube channel where we have a video library, and in the video library you're able to watch a video more specific on one certain topic. So a question I get is, what are some things that you can pass on infection wise to your unborn fetus and things of that nature? And the question's a little more specific to GI type infections such as SIBO, small intestinal bacterial overgrowth, or even h-pilori. Those infections live within you. They do not cross to your fetus. So h-pilori lives in the mouth and in the stomach. So once your baby's born, if it drops its pacifier and you put that pacifier in your mouth and then in your baby's mouth, you can definitely give your baby h-pilori doing that. But you having h-pilori will not pass that h-pilori from your mouth, your stomach, to your fetus. The baby's in a placenta, and it has its own blood system. With that said, during pregnancy, we don't recommend detoxing. What they have found is they have found over 300 toxins in the umbilical cord. And that doesn't mean that your baby's getting all those toxins. What it means is that umbilical cord is filtering those toxins, and so is the placenta. So I don't recommend detoxing while you're pregnant, while you're nursing. Now, natural things you can do to detox are Epsom salt baths, sweating, exercising, eating organic foods, and you can still do a lot of natural things that promote your detox pathways, like lemon juice. You can juice certain things like parsley, cilantro, where you can eat those things, right? You can make a great detox salad. I actually have a recipe for one at Cooking with Dr. Olivia that has things like cider vinegar, lemon juice, olive oil, some fresh organic cabbage, as well as parsley, which promotes detoxification. So there's things you can do to promote detoxification without actually detoxing. And I wouldn't recommend you do a full-blown aggressive detox while you're pregnant or while nursing. And nursing, again, you're walking a fine line there, because I work with some people that have been nursing 18 months, 2 years. Your baby is no longer depending on you as their primary nutrient source. So within that first 6 months of life, they really are. And when they're in utero, they really are. Once you start introducing foods, things change a little bit. And I don't know if it's because I'm expecting, but I have gotten so many pregnancy questions that my Doctor Olivia Naturals department has actually asked me to create a series of videos, which I will be recording in the next few weeks, about nutrition by the trimester. Really, your nutrient needs for your first trimester are totally different than your second and third. I also want to talk to you about nutritional deficiencies that are very common during pregnancy that need to be monitored. Vitamin D, B12, folate, iron, and ferritin. Anemia is very common during pregnancy, and those are things you want to have checked as early as possible, as well as at the halfway point. I think those are very important things to keep an eye on. Very important in prenatal nutrition that you're taking methylfolate and not folic acid. So there's all different things we'll talk about, but we'll create a whole different series of videos for that. So next question, what might happen if I take a Pregnenolone supplement alone? Nothing. Most over-the-counter Pregnenolone supplements are only 10 milligrams. Prescription Pregnenolone tends to be higher doses of 100 or above, so nothing's going to happen to you. With that said, why do you need Pregnenolone supplementation? So Pregnenolone is an androgenic hormone, which means it works with the adrenals. So somebody might need more Pregnenolone if they have a cortisol imbalance. Pregnenolone is also a precursor to progesterone. So what that means is if you have low progesterone, you may have low Pregnenolone levels. So I don't think you're going to hurt yourself with supplementing, but I'm wondering, why would you supplement? Pregnenolone's not like a a random over-the-counter supplement that you would take. So I'm not really crystal clear on that question or why you would take it unless you've had some type of testing done, like a Dutch complete test that looks at cortisol, looks at androgens, looks at sex hormones. I would rather do the appropriate testing and reverse engineer a program or protocol based on what you really need than just taking supplements to take them, especially Pregnenolone. Next question. My doctor recommended K2 supplements for bone and cardiovascular health. What is your opinion on this? I'm a huge fan of K. You're going to get vitamin K in dark leafy greens. Vitamin K is not that hard to get in diet. The nice thing about K2 is it doesn't have that blood thinning effect that K1 has. So if you're someone who's taking blood thinners, you can still safely take K2 without it affecting your INR levels. So I'm a big fan of K2 because it helps with the absorption of vitamin D. So we need vitamin K to absorb vitamin D. So you'll find many supplements out there that have vitamin K2 and D3 together. Now, how does it affect bones or bone density? Well, one way it does is because if you have excess blood calcium, you can use vitamin K to grab that excess calcium out of the blood, which is where you don't want it. That's where it can cause problems like arteriosclerosis leading to stroke. So you can use vitamin K to grab that excess calcium out of the bloodstream and bring it into the bone, which is where we want it. And that's how it helps cardiovascular health as well. So it does have good cardiovascular benefits, and K2 won't have that blood thinning effect like K1 would. So it's okay to take if you are on blood thinners, or it's safe to take if you are on blood thinners. But always check if you are on any type of blood thinner. Your doctor should be monitoring what's called your INR levels. That really determines what you can and can't have as far as vitamin K and dark leafy greens. So 2 bonus questions. Let's go to SIBO. I get so many questions about SIBO, and one thing I'm getting a lot around SIBO is people that are questioning their doctors. I think if you hired a doctor and if you're working with a doctor, you need to be compliant and follow their recommendations if they're designing protocols for you to help you with your SIBO. If it doesn't work, if you retest and the SIBO is still there, if you get worse, if you don't get better, then I think it's time to start questioning that. But I do think you have to trust the team that you're choosing to work with or choosing to hire. The biggest thing that I just want to clear up are different antimicrobials out there for SIBO. So traditionally, the medication prescribed for SIBO is Xifaxan, neomycin, or Flagyl. Now, Xifaxan is probably the most effective one for SIBO, but even if you choose medication or natural, many times SIBO has to be treated more than once, 2 and even 3 times. And you can treat 2 to 3 times back to back, or you can treat, take a break, treat, take a break, treat, take a break. And that's what I do, the people that I'm working with, although I use natural agents. The ones I use are biocidin and candibactin. I don't use them both. Depending on the case, I might use biocidin. If I have somebody with a positive breath test, I'm probably going to use biocidin. If I have a stool analysis on someone, or I see that that person has yeast overgrowth as well as bacterial overgrowth, I'm more prone to use candibactin. In those cases, you may need to use something called a biofilm disruptor, which these bugs hang out in the biofilms of each other. That's why I use biocidin and candibactin, because they both have biofilm disruptors. Sometimes if you start taking something to kill off the bad bugs and you feel worse, you get diarrhea, you get really bloated, it's not a reaction to what you're taking. It's actually those organisms dying off, and your body's trying to get rid of them, which is why it might give you diarrhea. Or they might die in your gut and you might bloat out really bad. You can use a binding agent such as activated charcoal to bind to the toxins that are being released as the yeast bacteria dies off in your system. So what probiotics are okay to use if you have SIBO? Ultraflora Acute, which is a S. boulardii, Saccharomyces boulardii probiotic, as well as one called Ultraflora Integrity. They're both made by Metagenics. And Ultraflora Integrity was actually studied in a population with SIBO and studied in a population with leaky gut. What I don't recommend you do is you take probiotics that have lactobacillus, acidophilus, bifidobacterium. That I don't recommend if you have SIBO while you're going through an antimicrobial protocol. So I think that kind of puts to bed some of the concerns with SIBO. I know there are other practitioners out there that use different things than I mentioned. A lot of doctors out there like iberogast, and some naturopaths use it, some gastroenterologists use it, and iberogast is very good for bloating. A lot of people like to use Atrantil. I am not opposed to Atrantil. I use it in people, but I put them through a gut cleanse or an antimicrobial protocol before I put them on Atrantil, because Atrantil is going to help prevent regrowth of SIBO or inhibit the regrowth. It's not the best antimicrobial protocol to use. So those are some little trivia questions related around SIBO that I hope put your mind at ease if you know you have SIBO, if you failed a breath test because you have methane or hydrogen gas related to SIBO. Last but not least, I have a few detox questions here that I'm going to throw in as a bonus as well. Can I detox without a gallbladder? Yes, you can. I would pull fat out of your diet if you're doing a detox and you don't have a gallbladder, because where the liver likes to dump those toxins is in the gallbladder to leave through your gut or through your intestines. So cut fat out of your diet. I know fat's healthy. I'm not arguing that. I'm saying if you don't have a gallbladder, then I would cut fat out during a detox, and you can also add a digestive enzyme called lipogen to your detox. Can I eat cheese on a detox? Heck no. Detox is totally gluten-free, dairy-free, soy-free, refined sugar-free. It's got to be walking the earth or growing from the earth in order for you to be able to eat it on a detox. All foods found in nature on a detox. So absolutely no cheese, no dairy. Last question, should I cut out all fruit if I'm doing a detox and I have cancer? Not necessarily. No, not necessarily. We usually give you 2 fruits daily while you're on a detox. If you're following more of a ketogenic type diet due to cancer, I understand that. But if you're doing a detox and you do have cancer, I would say you still want all dairy out of your diet. So you can do a detox vegetarian, vegan, but the rules still apply. If you don't have a gallbladder, you got to cut fat. I would still recommend you add lipogen, and it's all nature-made foods. If you are going to eat animal proteins, I recommend they're free range, wild caught, organic. And if you want to do a detox completely fruits and vegetables only, that's okay. If you do have a healthy gallbladder or a gallbladder, you can have healthy fats. It's absolutely okay. You can customize it to whatever your dietary needs are, to whatever your belief system is. There are just some things that are not okay on a detox: gluten, dairy, sugar, soy. There are some things you shouldn't have if you don't have a gallbladder, because your body has a harder time breaking down fat and protein foods. And if you choose to do your 10-day detox or 20-day detox, vegetarian or vegan, go for it. So as usual, great questions this week, guys. Feel free to post your questions in our Dr. Olivia Naturals VIP page. That's where I will grab the questions from to get on our weekly FAQ. Also, there's a closed group, Detox with Dr. Olivia, where all of my detox files are loaded, all of my menus and shopping lists for detoxification as well as gut cleanse are loaded. There's always a group detoxing. It's super fun. I'm not detoxing with you guys right now because I'm pregnant, and I don't recommend detoxification during pregnancy or while nursing, but I always try to hop in there and see what questions are being asked, and it's really cool to see the support you guys give each other in that group. So thank you for following. Again, if you're looking for more information, just subscribe to our YouTube channel. We have a video library there. Within our closed groups, make sure you like us and turn on your notifications, and this way you won't miss any of our posts. Have a great one.